First, though, contextualize this moment in this space by stating the obvious. Everything that's going on in the United States, everything that's going on in New York and other parts of this country, we want to extend not only thoughts and prayers, but we're also extending a hand of support with ventilators. Today we announced 500 ventilators from our cash will be sent to the national stockpile to be immediately distributed to states in need, particularly the state of New York. So I just want to thank our team for assembling over the weekend the appropriate equipment, making sure that these vents work, making sure that these are the vents that were recently refurbished and repurposed for exactly the purpose that they're assigned. And again, our hearts and prayers go out to everybody as it relates to meeting this very difficult week head on and making sure that we have all of the appropriate personnel, appropriate sites, as well as equipment, particularly ventilators, to support those most in need. I want to, though, make an argument for the state of California's efforts in the context of putting in perspective the work that's being done, not just, again, here, but over the course of many, many months, by reminding everybody that we started on this journey in January with repatriation flights that came back into the United States through the state of California for people in mainland China, American citizens. We brought them on to Air Force bases here in the state of California. It began the formal relationship, the formal partnership with the federal government, the CDC, and their respective agencies. Of course, that generated a lot of attention and obviously raised the alarm bells for the state of California that we needed to prepare not only to address the needs of those that were being repatriated, but begin the process to really start focusing on preparing for COVID-19 and the prospect that this virus was going to spread. That was brought further into focus with the Grand Princess Cruise Line, which generated national attention and certainly generated a lot of energy and focus in Northern California, in the Bay Area. And those relationships were only strengthened. And as a process of, or rather as an extension of those relationships being strengthened, it forced our hand to really start looking at assets, looking at sites, alternative care sites, not just our hospital sites, but alternative care sites that can not only meet the needs of those that were coming off the Grand Princess, but the expectation then that the coronavirus would spread and the peak needs would exceed our capacity to deliver within our 416 hospitals. So over the course of months, the state of California has been preparing in a very deliberative way. We've phased our preparation in different frames. Phase one is the focus of today's press conference. We want to let folks know that our phase one procurement includes some 50,000 beds above and beyond what is currently available in our hospital system. And I say currently with a caveat. We have 416 hospitals in our hospital system, some 75,000 licensed beds. We have asked the hospital system itself to create capacity to surge by roughly 40%, so 30,000 beds within the hospital system itself. The additional surge, the 50,000 phase one goal, would come from the state working with partners at the local level, 20,000 beds for alternative care sites. So within the hospital system, acute care, a focus on building capacity and assets in and around those hospital footprints, in and around the emergency rooms, in and around the operating rooms, with existing staff to the extent we need to surge the staff, a health corps support that we've been talking about the course of the last week or so. This is one of the sites of the 20,000 sites that the state of California has procured, and as you can see behind me, quite literally is being brought into a condition where we can start accepting patients as early as April 20th. We're here in the Sacramento region, the Sleep Train Arena, where the Sacramento Kings once played. This is a site that will provide for 400 beds specifically for patients that are either being discharged from our hospital system, from our emergency departments, or going here directly with mild to moderate symptoms. The acute care will continue to be provided in our hospital system as part of their larger surge. This is one of a dozen-plus sites that the state of California has already procured. We currently have locked in 4,613 specific bed sites now throughout the state of California. We have sites like this arena in every major region in the state of California. Those 4,613 beds are currently locked down, but they're not by any stretch the totality of what we're trying to source and the number, again, of 20,000 that we ultimately are going to seek. We have 5,005 additional beds that we currently have identified and in the process of negotiations, but we've locked in, like we have here, 4,613, again with an anticipated peak into mid-May. So we're well on schedule, all part of our ongoing preparation plan, phase one, to get to those 50,000 beds. Let me flesh out a little bit more about what those beds look like, because they all don't look like this arena. We worked first to secure Seton Hospital in Northern California, hospital that was no longer operating as it once was, 220 beds specifically now available at Seton. We did the same for St. Vincent Hospital down in Los Angeles. 266 beds will be made available. And by the way, that goes operational on Monday, April 13th, because of a partnership with Dignity and a partnership with Kaiser. And I want to thank Dignity and Lloyd Dean, Kaiser and Greg Adams for their support, their stewardship, working with the county to secure that site and make St. Vincent operational. Of course, the USNS Mercy, also part of that hospital surge, 550 beds as part of phase one of their capacity build. So those are on the hospital side. Those are assets locked in. On the alternative care side of things, not only, again, this arena, but we've identified Fairview Developmental Center, 520 beds. We've identified Porterville Developmental Center, 246 beds. We have identified other locations throughout the state of California, including hotel rooms in San Carlos, 120 beds. And then we have on top of that all of those medical stations that came from the federal government with the support of the president, 2,000 beds as part of that FMS program. 5 of those sites are already up, not necessarily running, but locked down, and we've unloaded all of the cash, the equipment, and supplies, and we have prepped those sites. 3 additional sites of those original 8, 250 beds per. That's the 2,000. 8 sites, 5 done, 3 remaining. Those 3 are up and around Shasta, Butte County. We have one down in San Diego, and I want to congratulate the work of the county down there for announcing that and finding an appropriate site for that. Nathan Fletcher, supervisor, and others that were doing that over the weekend. And then a site in Fresno that we are in the process of unloading and setting up. So those 8 sites, plus those hospitals, plus alternative care sites like this, that's the 4,613 beds that we have locked down and ready to go with. That said, it's one thing to have the beds, it's another to have the personnel. And just to explain a little bit about how these things are working, the hospitals, I talked about the partnership with Kaiser and Dignity down in Southern California. Each and every site has different operations, different specs in terms of support, who's managing them, where we're procuring the appropriate protective gear, and the like. The FMS sites, these medical stations, are county-state partnerships. In some cases, the county is taking all the responsibility themselves, but broadly, county-state partnerships. As it relates to sites like this, we are working with the county, and we are working through our health core, which now has a total number of applications. This was the healthcore.ca.gov website we launched less than a week ago. Over 81,879 people, not over, as of this morning, 81,879 people have filled out a formal application on that site. That will provide the surge capacity in terms of personnel we'll need to appropriately staff, as an example, the 400 beds that will be on this specific site. And by the way, I recognize for those that are focusing with real acuity, detailed attention on that health court site, we have a lot of existing licensed medical professionals that are currently working that have also applied on that site to potentially be redeployed to more acute needs within the system. But it's still a jaw-dropping number. 80,000+ people that are willing to meet this moment. Again, these are the phlebotomists, the EMTs, the paramedics, the nurses, nurse practitioners, and doctors, and the like, radiologists that have all filled out that application. So physical sites, the human capital that are needed, and doing everything we can to procure more PPE. We are not naive. We're very proud to be able to extend a hand of support with those 500 ventilators and send them back east. But we're not naive that we need to continue to procure more ventilators, not just gowns, masks, coveralls, shields, these N95 masks in particular. And we continue to do everything in our power to continue to build out that inventory as well. Again, it's a three-legged stool. You need the place, you need the people, and you need the protective gear to make these things work and to meet the surge responsibilities and meet the surge expectations that are part of our modeling. Again, the models mean nothing if we begin to step back and change our behavior by getting cabin fever and no longer practicing physical distancing. Physical distancing is working. The more we commit to meeting this head-on by continuing to practice social distancing, but substantively physical distancing, wearing the appropriate, well, not masks, but face coverings when you are forced to get in a queue or in a line and be around other people where you can't practice physical distancing, for example, at a grocery store. If we continue to do that, we continue to hold the line, then these models will continue to buy us time, because you, by definition, are bending the curve, which allows us the days and weeks to do exactly what you see being done right behind me here at Sleep Train Arena.